Hey guys, before we get started, I want to get a definition and some acronyms out of the way. So today I'm going to be utilizing two techniques, a P&S, which stands for pin and stretch, and an AET, which stands for an active engagement technique. I'm going to be using these to work on thoracic outlet syndrome, which is, if you don't already know, a condition in which the nerves and the blood vessels get trapped between the clavicle and the ribs and create a host of sensations down the arm, depending on the severity, but it's something that, as soft tissue experts, we can help. So without further ado, let's get started. So obviously these techniques can be used for any dysfunction that shows up with the shoulder, the neck, and the head area. And I encourage you to use these techniques in combination with any other techniques that you love or especially think are effective in this area. But I'm going to demo for you and walk you through the steps of a P&S and an AET specifically targeted for thoracic outlet. I'm starting with the upper traps and the levator scapula, and I'm starting with a pin and stretch. So what I'm doing here is I'm shortening the muscles. I'm pinning them down, which you can either do compressing directly down into the skeleton, or you can grab them like I'm doing here with my thumb and my forefingers. And once I've got a good grip, I'm stretching them out. So I'm using my left hand in this instance to bring her head away from her right shoulder, stretching out these muscles, and pinning this muscle down before stretching it out gives you a little more control over the depth of the stretch. So just to review these steps, I'm shortening the muscles, bringing her right ear towards her right shoulder, pinning it down with my right hand, and then stretching them out, using my left hand to bring her head away from her right shoulder. You can address these two muscles together with this technique, but to isolate them out, the traps are going to be more superficial and the levator scapula is going to be a little deeper. So if I want to target the levator scapula, I'm really going to sink my fingers down to find that superior angle of the scapula and get the attachment site. And then as I stretch these muscles out by pulling her left ear to her left shoulder, I'm also going to turn her head to her left shoulder because the levator scapula's job is to turn the head to the same side. So an opposite rotation is going to stretch that muscle out. Focusing on the same muscles but using an AET this time, I'm going to have my client engage the muscle. So I'm compressing down into these muscles and I'm having her shrug her right shoulder up towards her right ear. Knowing the actions of the muscles is going to be crucial to applying these techniques to any muscle you choose. And the reason why I'm demoing these two techniques together is because you can often use them in combination with each other. So what I'm doing here as I compress down on the upper traps and the levator scapula, I'm having her engage these muscles. First by pulling her shoulder up towards her ear, and then the second time I do it, I'm having her bring her right ear towards her right shoulder. And as she contracts these muscles, I'm sinking down so that when she releases, my pressure goes beyond the depth that I was at just a second ago. So I'm able to get a little bit deeper, and then if I combine a stretch, when she releases, I'm combining an active engagement technique with a pin and stretch. This is really powerful work and starts to get to a deeper level of tension and contracted tissue than you can get without using any kind of movement. On the third active engagement technique with this client, I'm having her push her shoulder back towards the table and then bring it up towards me, which is another action of the traps very specifically, and then combining that with the levator scapula. So as she performs these actions, I'm able to ask her to move in different ways, accessing all the different fibers of the muscles that are affected, and making sure that the movement is then incorporated with my techniques. Up until this point, I've been grasping the tissue in between my thumb and my finger, and this time I'm using my thumb to sink down into the superior angle of the scapula, really accessing the attachment of the levator scapula. So I'm performing the same techniques, but just using a different mode of compression into the tissue. So as I sink down with my thumb, I'm asking her to bring her scapula up towards her ear, which is the action of the levator scapula, and then when she releases it down, I can sink in a little bit deeper and create a bigger change. The second time I do this, I want to use the pin and stretch at the end of the compression. So again, combining those two techniques. So sinking down, having her engage the muscle, and then combining that with a good stretch. The combination of her active engagement and then my passive movement of her tissues, well, I'm not going to say it's life-changing, but it's pretty powerful. As you can see, I'm fleshing out the origin of the levator scapula after I do this work, and I'm doing this not only to connect the whole area, but also because I'm about to transition to the scalenes, and they share some attachment sites, so it works pretty well. So the scalenes, as you've probably already experienced, are not the easiest group of muscles to work on, and I like to approach them at the insertion on the first rib as best I can. So I'm starting here by pushing back the upper traps and addressing the anterior aspect of the superior angle of the scapula. And I'm using a pin and stretch, but my focus is mainly on the connective tissue that winds all the way up the lateral portion of the neck. So the scalenes start at the transverse processes and then come through this region and sink down into the first rib, and this is exactly where the chaos of TOS starts. I'm working my way lateral to medial as I start to sink in to get to that first rib, and that first pin and stretch that I did has a purpose. I want to start to clear away a lot of that congested connective tissue so I'm able to sink down deeper into that first rib and really address the scalenes. A pin and stretch here looks like this. I've brought her right ear towards her right shoulder, shortening the scalene muscles, and I'm using my fingers to sink down underneath the clavicle, pushing out laterally just a little bit down into that first rib. And once I've found that attachment site, I'm going to compress down and then use my left hand to pull her head again away from her right shoulder, stretching out those tiny little ropey muscles. An active engagement technique is a little bit trickier in this area because the scalenes do lateral flexion and rotation of the head and neck, but they're buried under bigger muscles that also do the same thing. So I'm going to focus on their unique ability to elevate the rib cage during forced inhalation. So I'm going to sink my fingers down onto that first rib, and I'm going to have my client take a really big deep breath. When she breathes in, I'm coaching her to sip in those last little bits of air as she's at the top of her breath to get the rib cage to elevate up to where I can really feel the scalenes contract. And then when she releases down, I'm sinking down a little bit deeper and accessing those attachment sites as they relax down and soften. This work can get a little intense, so it can be really helpful to offer some visualizations that your clients can practice while you're sinking in so that she can let go a little bit deeper. Some ideas for this area might be to have your client clench her jaw shut and then let it relax all the way, or press her tongue to the roof of her mouth and then also let that relax down all the way. These little engagements of muscles that are connected down through the neck and into the shoulder can help unravel the kinetic chain of this part of the body. Sticking with the theme of connectedness, I'm going to work my way up into the neck and start to work on the origin of these muscles. I've spent a lot of time down on the insertion, and now I want to get into the transverse processes of the cervical spine, which happens to be a tiny space with a lot of attachments, so needless to say, treat it with care. I'm going to start with a pin and stretch, so I'm going to soften the muscles by leaning her head over to the right, sinking the pads of my finger in towards the transverse processes, and then rocking her head over to the left away from my side of compression. This is kind of a mini version of a pin and stretch for a mini little area that's got a lot going on, so the subtle movements here are pretty powerful. You don't need to be huge and big and vigorous with this. Moving on to an AET, the same rules apply. This tiny area doesn't need a huge big movement. So I'm compressing down in towards those attachment sites, and then I'm having her bring her right ear towards her right shoulder, but just a little bit. The motion needs to be small, thinking more about the movement of the head and not the entire head and neck all the way over to the right hand side. Little muscles are more responsible for littler movements, and big muscles are responsible for big movements. So if you want to focus on little muscles, try having your client do little movements. I'm about to move on to the shoulder and the arm, but I want to remind you really quickly that if you talk to your clients about what you're doing, they're really going to appreciate how smart you are. So if you say something like, I'm really just releasing the splenius capitis cervicis through the scapular attachment of the scalenus of the nervous plexus and the brachial complex that runs through this area and region, you're going to be release the contracture of the area, they're going to love you. As you know, the traps are one of those muscles that doesn't just pull in one direction, it pulls in both directions. So it doesn't just pull the head and the neck to the side, it also pulls the shoulder up towards the head and the neck or the scapula back towards the spine. So if I'm working from this direction, standing at the arm and manipulating what the shoulder does, I'm able to access these muscles from a different perspective, hence getting a little deeper into this work. Starting with a pin and stretch, I'm going to focus on the levator scapula and the traps again, but instead of pinning them down and then moving the head away to stretch them out, I'm going to push the shoulder up towards her ear and shorten those muscles, and then pin them down with my left hand, and then use my right hand to pull the shoulder down away from her head and neck, creating that nice stretch. I'm a firm believer of using a global approach to an area. So you start to access these fibers from all different directions, and you start to get into the nooks and crannies that you can completely miss coming at it from one approach. I'm going to do the same thing, but just show you a different camera angle so you can see from my ceiling cam all my gray hair. No, I'm kidding. So that you can see the movement of the shoulder as I lift it up towards the ear and then pin it down and pull it away from her shoulder. I'm really creating a nice stretch in those muscles that gets kind of the lower fibers and the attachment site a little bit more deeply. And like I said before, you don't actually have to pin it down onto the skeleton. You can just grab the tissues with your hand. As long as you're creating a compression, you want to make sure that you are stabilizing one part of the muscle as you stretch the rest of it out. The bonus of grasping the tissues sometimes as opposed to compressing down is that I can manipulate them a little bit underneath my fingers and create a little bit of friction as I work. The AET in this position for the traps and the levator scapula looks similar to when I was sitting at the head of the table, but the big advantage from this direction is my own body mechanics. So instead of sitting and pressing in with my thumbs or my fingers to get that compression, I'm now able to lean back a little bit with my entire body weight, which is going to help relieve some of that tension on my own forearm so that I can create maybe a deeper pressure if my client is requiring a lot more force. So same idea as before, instead of compressing down into the scapula, I'm grasping the upper traps and the levator scapula fibers and using that compression against her contraction of those muscles as she elevates the shoulder, and then when she releases, I can sink down deeper and flush all of that out. The other really cool part about addressing the upper shoulder from this direction is the ability to wrap my fingers around the clavicle and address the scalene attachments from this angle. So instead of sinking down into the ribs, I'm actually hooking up into the clavicle just a little bit so that the connective tissue that extends down from the scalenes and onto the ribs, it also does come up into the clavicle. And all of those tissues that for most people who have thoracic outlet syndrome or many shoulder, neck, and head dysfunctions, there's gonna be adhesions in here and there's gonna be some contracted tissue that has not let go for a long time. Hooking my fingers underneath the clavicle and clearing away a lot of that congestion is often something that has not been tapped into and can sometimes be the key to a lot of relief. Just to clarify, for the pin and stretch, you want to shorten the fibers by bringing the shoulder up towards the ear, sink in with your fingers underneath the clavicle, and then stretch the fibers out by pulling the shoulder down away from the ear. And then for the AET, which I'm doing here, sink into the fibers, have her take a nice big deep breath in, and like I said before, sip those last bits of air in at the top of her breath so you can really feel the scalenes contract. And then when she exhales, sink down into those fibers, do a little extra work, and pull everything out down the arm. Working my way down the anatomical ladder, so to speak, I'm going to start working into the pecs, but I usually like to clear some space in the shoulder before I do that. Because the pecs cross over the shoulder, I just want to give the shoulder a little traction and prepare the pecs for the work I'm about to do. So this first pin and stretch is grasping the tissues, not pushing them down into the rib cage, but making sure that I'm using my finger pads and my thumbs to grab onto the pecs, pull them away from the rib cage a little bit, make sure that her arm is really letting go, and I'm using my left hand here to bring her arm back out into extension and abduction, which is going to lengthen the fibers of the pecs. So I'm pinning them down and stretching them out as I move her arm around a little bit like she's doing the backstroke. This time I'm going to pin her muscles down against her rib cage using my palm. I don't want to be too sharp here, mainly because the pecs are superficial and the pec minor, which I will get to in a little bit, is underneath that, and I want to stay focused on the pec major. So using my palm and moving her arm around still gets that nice pin and stretch. This is especially good if your client feels limited in their range of motion with their shoulder. If your client is a little more flexible and that first technique wasn't quite enough, pulling their arm above their head and standing at the head of the table is a great way to access a little more depth into the pecs and get a little more range of motion with the arm. So I'm using my right hand here to support my client's elbow and using my left hand with either a soft fist or the pads of my fingers to sink down into the pecs towards the rib cage, and as I compress down, using my right hand to pull her arm up, creating a really deep stretch, especially in the lower fibers of the pecs. Speaking of which, keep in mind how big the pecs actually are, and if you move your hand around a little bit, you're going to access all the different fibers, and that of course is going to be beneficial in encompassing the muscle as a whole. Switching back yet again to the grasping technique, I'm using that side of my first finger and my thumbs to hold onto the tissue as I use my right hand to let her elbow drop down and stretch those fibers out. Again, be sure to move your hand around and get all of those fibers. They will love you. So how exactly do you engage the pecs for an active engagement technique? Well, let me show you what I've figured out. I'm walking around the other side of the table and I'm taking her arm with me, and I'm holding her arm in a position that is a little bit like an L coming up from the table. And if you think about the fact that the pecs are really good for punching forward, or in a more loving action, hugging, I want to create a space that she can push her arm forward and out. So as I stand there, I'm having her hold her arm up, creating a fist with her hand, and I'm holding my hand at the end of her fist as a resistance and using my other hand to sink into the pecs, so that when she pushes towards me, her pecs are contracting and I can feel them contract, and when she lets go, I can sink in. Just to review all of that, I'm having her hold her arm up, I'm having her punch her fist into my left hand here and using my right hand to push down into the pecs. When she releases, I'm going to use my left hand to hold on to her arm and ask her to let it go. And as she's letting it go, I'm dropping it down towards the table and using my right hand to sink into the pec fibers and push them out away from the sternum as she drops them down and they start to stretch out just a little bit. This is a fantastic technique, and I've found to be incredibly helpful for people who've got rounded shoulders, for people who've got tension in their neck and chest area. This is a really good one. Same technique here, but I've switched it up a little bit. I've switched my hands and I've switched my grip. So my left hand is now, instead of compressing down, it's grasping the fibers of the pec major, and I'm able to really get a lot more depth with this technique. So when she pushes towards me, I can really feel them contract and I can really sink in against that contraction. And when she lets go, I'm able to pull the fibers away from the rib cage as well as do some friction and release a lot of the deeper tension and adhesions that are existing more laterally out with this area. The last muscle that I'm going to address that's going to put this thoracic outlet syndrome package together is the pec minor. So I've really loosened up the pec major, and now I'm ready to sink a little bit deeper and get to that muscle that is so small but so powerful. So if you think about the fact that the origin of this muscle is on the ribs and the insertion is on the coracoid process, which is part of the scapula, its action when it contracts is going to be to bring the scapula down into depression. So pulling the shoulder down away from the ear, essentially. Working with that knowledge, a pin and stretch is going to look like this. I'm sinking into the pec minor with my left hand and using my right hand to push the shoulder up towards the ear so that this muscle stretches as the scapula slides up away from the rib cage. As for an active engagement technique for this tiny little powerhouse, it's kind of like I've saved my favorite technique till last. I love to use this and find that it creates such a big change in my clients that they really notice. Okay, so I'm sinking into the pec minor again, and then I'm going to ask my client to take her right arm here, create a fist with her hand, and punch her hand down towards her feet. So she's really actively depressing her shoulder and pressing her shoulder down towards her rib cage, which this is what the pec minor does. So while my client's brain is asking these tiny little fibers to contract, I'm creating an outside force that's going against exactly what is happening on the inside. So it's that same idea of when a muscle contracts and then it relaxes, it has to relax beyond its normal state of relaxation. So as I create an outside resistance against this inside force, when it relaxes, my outside force is going to take over and get down to a deeper level and start to shift things while this muscle is in this really great state of being nice and loose. One more quick tip for the pec minor: if any of this work is too intense, you can just kind of sink in and have your client take a nice big deep breath. The rib cage is going to expand and you're going to get some stretch of the pec minor with that. So work with what your client is able to give you and make sure that you are working with what you can give to your client. When you're done with that work, be sure to flush down the arm and into the hand. Thoracic outlet is felt at the hand, so make sure you connect all of that and make that expert work that you've just done feel complete.